This is Mark Hughes with Karma Talks. Today we have Richard Master. He's the owner of MCS Industries, the leading manufacturer of picture frames and mirrors in North America. So Richard, welcome, and tell us, what's a guy involved in manufacturing of these type of products doing, making a documentary about the healthcare industry?
Hi, Mark. I'm very happy to dialogue with you about my subject of real passion, which is U.S. healthcare. Yeah, a lot of people ask that question, and you know, I had a very spontaneous, a reaction to something that kind of led me to begin to turn over the rocks of our healthcare system. You know, this happened about 4 years ago. I was in Santiago, Chile with my son, and we were being introduced, my wife and I were being introduced to his future in-laws, and my son got a asthma reaction to something in the air there. He had an inhaler that didn't have enough firepower, and we scurried out to the local pharmacy expecting to spend $80 to $100 for an albuterol inhaler, and lo and behold, it was 15 bucks.
Wow.
And very easy to get it. And so I turned to the pharmacist, and my future daughter-in-law asked in Spanish, do you have his blood pressure medicine? $4. So at the same time, it was in November of the year. That's the time when businesses begin to negotiate the next year's premium for healthcare. And we have, upwards of 200 workers and families and their families involved in our policy here.
Let me interrupt you just for a second. When you talk about negotiating your premiums, what does that mean? A lot of people don't understand. What do you mean by you're negotiating your premium?
Well, each year we have a contract with an insurance provider, a health insurance provider. And the contract is based on the performance, the expenditures that the health insurer has for maintaining the health of our population. And
so it's based totally on your population. It's not nationwide. It's your community of people, and they determine your premium basically based on the health of your community.
The health and performance and expenditures, principally of our community.
And you do it, and you do this annually, every year.
We do it every year, yeah. So in some years when we're not doing particularly well, we have high double-digit increases, and that's what we had been experiencing. We have people who've been with us for 35, 40 years, their entire careers at MCS. So we have an aging population, and a number of companies will ease older employees out. We don't do that at MCS. We like experienced, good worker people who are associated with us. We want to maintain them, but that comes at a cost. And
so
we're relatively, yeah.
This is fascinating. You have to. I think I understand this industry and all that pretty well, but this is all brand new information for me. And what I'm picking up on is this. It's a value judgment for employers to keep the elderly, the older employees on board because it costs more, and sometimes many of them are letting them go. It's strictly for cost.
That's correct. A lot of them are letting older employees go, and more significant, they're not hiring older employees. So you have this gap of folks above 50 years old who are frankly not employable because they're at a high risk of this major and growingly more major expense, which is called U.S. healthcare.
So one of the big problems with employing older people is it's totally the bottom line in terms of how much it costs the employer to provide health care for them.
That's correct. And not only are you impacted by the performance of health in your own population, but the provider community is gouging every year to a higher and higher extent. So we're seeing 3, 4, 5% inflation in healthcare costs persistently when the general CPI inflation rate is, in the function of around 2%.
Wow.
So every year we're seeing really significant growth. So that's why someone like Warren Buffett at the recent Berkshire Hathaway meeting was talking about healthcare cost as a function of GDP at 5% in the 1960s, and now at 17, 18% of gross domestic product. So we're being eaten alive by our healthcare system.
Yeah, no, I think I read in the information. Yeah. I think I read in the information that you sent me that healthcare is the third largest line item. Is that correct?
Third largest line item for many businesses. And in some cases, yesterday we were filming at a bus company, in the area, Easton Coach. And the CEO of that company has 600 employees, and 50% of his cost is employment cost. And he said to us, look, I can understand that the parts for my vehicles may go up 1 or 2% a year, and I can function that. I can build that into my model, my forecast. But I can't build in what the cost of healthcare is because it's so erratic. And also because the costs are going up so quickly and also so volatilely. It's really a big problem.
So what do employers do that are facing this, that are trapped in this cycle of escalating healthcare costs? What are the tough choices that some of them are making that is not necessarily for the best interest of our economy, for our employees, and for the healthcare of our nation?
Well, in that particular case, when employment, what he's selling is services, mostly services, he doesn't sleep well at night because he has long-term contracts with the municipalities, and he has, has to keep abreast of inflation in his wages. And then he has this massive and growing expense related to healthcare that he doesn't know what's going to happen from year to year. He's had 70% proposals for an increase. And then what he did is he went to self-insurance. So he has to use an insurance company's rates and administration, but he's basically responsible for the expense. He's not really insured. He's self-insuring.
Well, that would cause a person to not sleep very well at night.
And he doesn't. So he could have, a hepatitis C case, and it could cost him $80,000. He can have a person, in his group that has cancer, and that can cost over $150,000. The numbers are now astronomical.
So this is an epidemic that's happening across our business environment. Are business owners rising up and coming together? And you would think that there would be a mini revolt at some level. Maybe I haven't been watching the news or being aware of what's going on, but it doesn't seem that this has reached that proportion of awareness within the community to do something about this. What's happening in that regard?
Well, that's the real mystery. Why hasn't the business community voiced its concern more effectively than they have in the past? And that's why, frankly, we started making these movies to educate and to at least make businesses aware that there are solutions, and that there are best practices around the world which would alleviate this burden and this uncertainty. We're the only company in the industrialized world that, number one, in the modern industrialized world, that doesn't have pretty much universal coverage for all citizens, and doesn't follow the model of in general of a single payer system. There are variations. Germany has one variation, France has another, England has more socialized medicine, Canada has a system like our Medicare system where there is a payroll deduction and there is universal coverage, but the providers, the government acts like an escrow agent. It takes in the money, but the provider community, the hospitals and doctors, are privately owned. And as a matter of fact, doctors in Canada are freer than doctors in the United States. Doctors in the United States have gotten collectivized into these huge healthcare combines, and they don't like it very much, but they're forced to do it because the complexity of the system, the difficulty of interfacing with insurance companies have forced them to do that.
Well, my brother just recently retired after, 30 plus years as a medical doctor. And I think he was relieved to move on because in the last, how many years, he's had to bring on staff, paid staff, just to administer the insurance and to administer all the computer technology and having to report everything. And it's just become so cumbersome. And I think, I'm reading that, can you break down where each healthcare dollar is being spent, and is it being spent in an efficient manner?
Well, let me say this, that there have been studies on what it costs the average physician to interface with the insurance industry, $83,000 a year. It's an astronomical amount.
Now, that's for a single physician.
That's for a single physician.
So if you had a collective group, I'm not sure exactly what you say, a group of physicians, and there's five of them in there, that'd be $400,000. Is that what you're saying?
Well, that's what they're saying, and I think that they're also including the time that the doctor has to spend 4 or 5 hours a week.
Oh yeah.
Pleading with the insurance company to provide particular service. Now, he may have an intermediary, a nurse or a administrator doing some of that work, but he has to get on the phone with people on the other side and fight for his patients.
Well, now
and then there are problems getting paid. The doctor presents a bill, the insurance company may want to, pay 30% or 50%. In general, this is a really challenging and administrative problem. And it's also a problem in hospitals. There have been studies now that show that hospitals in the United States spend about 26% of their revenue on administration. And in single payer countries, it's 14%, 15, 16%. So it's a substantial cost associated with our complicated, difficult to use system.
Now, that takes me to the question I was going to ask when you were talking about the physicians having to take time to argue with the insurance companies or to advocate for their patients for services. How is that going to change in a single payer? Isn't there going to be some sort of standard in terms of what the single payer system is going to provide? I mean, they're not just going to write a blank check, are they?
Well, they're not just going to write a blank check. They're going to negotiate, something that we don't do very well in our healthcare system.
Because the insurance companies don't have to negotiate.
Well, they do negotiate.
Oh, okay.
They don't, the insurance companies in now are not as powerful as they used to be. Now, Medicare for doctor and hospital services negotiates and establishes rates. Those rates are about 20% less than private commercial insurance rates. Okay, and Medicare is the 800-pound gorilla because they are responsible for so many lives in our society. Okay, But doctors, but insurance companies, there are so many of them. They are not as powerful with these growing in power healthcare networks that we see. In our community, I'm in the Lehigh Valley region of Pennsylvania. We're the third most populous region in Pennsylvania. But when we have 400,000 or 500,000 people, we have two major hospital networks, nonprofit. One year, Aetna came in and tried to negotiate with one of those hospitals, Lehigh Valley Hospital, and said, we're not going to pay these outrageous rates. And Lehigh Valley Hospital said, good, you don't have to. We're just going to not include you in our network, and anyone who's insured by Aetna will not get service in our hospital. Oh, well, we were at that point insured by Aetna. And we turned to Aetna and we said, look, we have people living in the western part of our valley that need Lehigh Valley Hospital. What are we going to do? You have to send them to St. Luke's. Ooh, well, a number of our employees were not very happy about that. The next year, we had to transition to the other to the other carriers. And guess what? Aetna repaired its relationship, paid what Lehigh Valley insisted that they pay, and the matter was resolved. So it was resolved because of the monopolistic bargaining power of a particular hospital network, healthcare network.
That's
so
amazing.
Insurance companies they're huge, but they don't have the power in many areas to really drive rates down. The other incentive, excuse me, I'm talking to
No, you're doing great. This is amazing.
Okay, so the other incentive is insurance companies are really earn their money as a percent of total premium revenue, right? You have the Affordable Care Act, which allows insurance companies to make upwards of 20% of the premium dollar in overhead and profit. What are they interested in? They're interested in a higher level of premium revenue. So if costs go up in a society by 4 to 5 or 6%, that's a built-in increase in bottom line profitability. I'd love to have that in my company, that every year I'm going to have 4 to 5 or 6% additional revenue just by twiddling my thumbs. Well, that's what we're seeing. So the incentives are all wrong. They're wrong in this system.
Wow. In a 12-month period, about how much time do you think you invest taking time away from doing what you're supposed to do to run your company and all that? How much unproductive time do you think you have to devote to dealing with healthcare?
Well, I have a company that's larger than many of the companies. So I'm a CEO, but I have staff. I have
okay,
HR,
so you and all your staff, how much time have you projected?
I think it's hundreds of thousands of dollars to administer essentially a $2 million expense here at MCS.
With your time and your staff and all the time that goes into renegotiating every year and dealing with these problems of having to send employees to some other hospital and all that sort of stuff, it's an archaic system. It doesn't make sense.
Right. And it doesn't happen that way in Canada. So the business community should be all over a structural change, because it actually costs less. It costs less. So Canada, which started out in the 1970s when it instituted its single-payer system, it had basically the same level of longevity as we had, and they grew their longevity faster than we did, and their growth in healthcare cost was much less than ours. They're now around 11%, 10.5%, 11%, which is higher than most industrialized countries of GDP. We're 18%. So we're now at a competitive disadvantage to manufacturers in Canada, right? So, and then, you know, you talk to, and we've, in our movies, have been in Canada a few times in filming, and you talk to conservative business leaders in Canada, and you ask them, you know, how do you like your system? And they say, our system is great. Do you want to be in the United States? And some of them have even investigated relocating plants into the United States, and they say, no way, because we can't afford the millions of dollars in addition that we would spend if we relocated here.
Well, so here we're spending all this time on trade agreements and, you know, keep it in America and all that kind of stuff. And perhaps probably one of the single largest reasons and challenges that business owners have is providing health care to their employees.
Yeah, you know, and that's why Warren Buffett, I will go back to that because it just happened 10 days ago. Warren Buffett said that the American business community should not focus its attention on federal taxes. That's not the issue. The issue is healthcare. He called the healthcare system the tapeworm in the belly of American competitiveness. I can't imagine any more respected business leader saying anything more profound than that about the system. And then his second in command, a guy who's also very highly regarded, Charlie Munger, holds an interview immediately after the shareholders meeting, and he says that we got to get insurance companies out of healthcare, and that he's a single payer supporter. He said, I'm a Republican and Warren's a Democrat, but we agree on this. I think that's the green light. That's the green light that the business community needs. When an iconic group of businesses leaders, and they have 360,000 employees across the United States, says something as profound as that, then everybody else will wake up and start to smell the coffee, and they may even join our organization, which is called Business Leaders Transforming Healthcare.
Incredible. Well, we're going to take a quick break, come back, or during the break, we're going to have everybody have an opportunity to take a look at the trailer, the movie, Fix It, and we'll be back to continue our conversation with Richard Master.
As a result of foreign competition, our gross profit margins deteriorated. We had to watch every penny of overhead.
Every penny, every half penny on this product.
And the one area that was so confounding was healthcare costs.
Every employer I know, they dread the next hike in their insurance rates.
The current costs of the system are becoming intolerable.
Why are we creating an extra hurdle for business? It's tough enough out there.
We looked at opening up a U.S. operation. If I had to increase my costs by over $1 million because of insurance coverage costs, that alone would probably drive me to bankruptcy.
Why are we making it harder for people to provide goods and services to the American public while employing people and providing tax revenues?
Healthcare costs are going up 2 to 2.5% above the projected gross domestic product. So it is running away from us.
Health insurance is a really complex system.
I cannot read my insurance policy. I don't understand it.
The variation in what hospitals are getting paid was more dramatic than we thought.
How are the prices set? I'll wager you have no idea.
Nobody really knows what it costs, and what healthcare systems have learned is that they can charge whatever they want.
You see, there's no accountability. The buck doesn't stop anywhere.
Our current broken healthcare system is the most rationed healthcare system in the world. That's why 1/3 of Americans don't get the healthcare they need.
Pity the poor company that's more labor intensive than us. They are going to suffer dramatically. And if they are having bad years, if they're on the verge of collapse, this is going to push them over.
We are undermining our capacity to function, let alone compete as a society, because of the rising costs of healthcare.
If I told you that every one of your employees could get the health care they need guaranteed, that your costs would go down, everyone would pay less and get more, you might be skeptical.
Just imagine what it would mean for this country if we could cut our health care bill by 25%. Imagine what it would mean for our business community not to have this albatross around their neck. It would be extraordinary.
Hello and welcome back. We're with Richard Master, and oh my gosh, we're having an incredible conversation about the impact on the healthcare industry on business owners and the impact in terms of what it costs them, to provide healthcare to their employees and the time commitment. And it's overwhelming. So Mr. Master actually took the time to, produce a documentary film. So Richard, tell me, what was the motivating force for you to, you don't have a background in film production, do you? Why did you do this?
Well, I as I said before, I was coming back from this little experience in Chile, and I have a friend who's a filmmaker, Vince Mondillo, who's also in our local community, and we have animators here, and so I called Vince and I said, we've got to do something about this. I'm negotiating a 17-18% increase in our premiums. I just came back from a foreign country that sells, pharmaceuticals at a fraction of our cost. I think the first thing we need to do is research. Let's start turning over these rocks and see how dramatic this problem is. And every rock we turned over there were these horrific circumstances. I didn't realize the proportion of the problem. What does it mean when we say that healthcare is 18% of GDP? The governments at all levels spend about 52% of that 18%. And it's $3.3 trillion a year. The entire federal budget is about $3.5 trillion. So, what we saw was that the national defense, which was at one point, maybe 10 years ago, equivalent with healthcare in the federal budget, has now been eclipsed by healthcare. National defense is around, I guess, maybe 16%, and healthcare is 27, 28% of the budget. It's crazy, and healthcare is growing faster and it's out of control. So that was one aspect of it. And then we looked at our expenditures, more closely, because we get those reports from our insurance company. What are we spending the money on? Well, I had a couple of our employees who had hepatitis C, and they were paying $1,000 a pill for this miracle cure, which in one case wasn't such a miracle. It took 2 sets of doses for one employee, and then the other employee required some additional medications. So we were spending $300,000-$400,000 for one illness, and then we were looking at pharmaceuticals. Pharmaceuticals ended up being 30%, 33% of our overall spend. And we looked at specialty drugs, the rise of specialty drugs. 15 years ago, we had 10 specialty drugs. We now have 300. And the specialty drugs are incredibly expensive. And they don't have to be, because we looked at the research in that. I guess we're getting into pharmaceuticals, but we looked at where does the research dollars? The federal government spends $32 billion on basic biomedical research, and the pharmaceutical companies, by law, can take that research, commercialize it, patent it, and charge extraordinary prices. And so not only is the government spending the $32 billion to develop the drugs, they're also spending extraordinary amounts of money to pay for individuals in our society to receive the drugs. So they're paying twice.
Wow.
So, we met with a economists. We met with activist doctors. We filmed in Canada. We looked at Taiwan and Europe's operations, and so we really got a very broad base of research and interview to make this movie. And we concluded that single payer certainly is the most efficient way to do it. And I'm a business person, following basic business practice. I want to eliminate all these middlemen. I want lean manufacturing. I want transparency in a system which we don't have. If you apply all these basic principles, which are sort of inherent in a single payer model, you can save tremendous amounts of money. What we project that we can save is upwards of $700 billion a year. And if we provided health care for all, and if we reduced the levels of deductibles and made the system more usable and fair for workers and their families and all individuals in society to use, it might cost us another $200 billion to do that. So, so the net is 500 billion in savings. Yeah. 500 billion in savings for a Medicare for All program in the United States.
So this is not unique to you. Employers, business owners all across America are facing the same problem. We can't expect all of them to be inspired, motivated, frustrated enough to go out and make a documentary film like yourself. And many of them, there's we talked about that. Why aren't businesses, sort of rising up in revolt and, leading the charge to change this? Is it because the healthcare industry spent over $1 billion in lobbyists to influence legislation?
That's certainly one part of it.
Is there a sense of hopelessness? Is there a sense of being beaten by?
I think there is. I think there's a sense of hopelessness. Where do businessmen go to get this kind of relief? Well, they might join the local chamber of commerce, and they might go and make a case before the healthcare committee of that chamber of commerce. But they're going to discover that the healthcare committee is peopled by insurance salesmen. They're
not going to get anywhere.
And they're going to discover that the health insurers and the pharmaceutical companies and the local hospitals will dominate the local business society. They do. They're the largest employers. Hey, wake up. I'm from the Lehigh Valley area of Pennsylvania. Bethlehem Steel, Ingersoll Rand. Well, they've been replaced by the two largest employers are St. Luke's Hospital and Lehigh Valley Hospital. Even the cultural institutions here are influenced by corporate dollars, by dollars that are coming out of these institutions. So
if you could wave your go ahead.
I wanted to say that when President Eisenhower, in his farewell address said, "Beware of the military-industrial complex," the modern iteration of that is really the healthcare sector of our economy. They are dominating not only local politics and local economies, but certainly they have control over our Congress through their lobbying efforts and campaign contributions.
So if you could wave your magic wand to change this, to create a movement or a group of people that could stand up and resist the power and the influence of the healthcare industry with our Congress, what could people do?
Well, and this may be the subject for a third movie that we're looking at, and it's really the influence of money in politics. And the solution there probably is some form of federal financing of elections. We've got to make our politicians independent of the special interests in our society. You know, I sound like a wacko. You know, I'm an Eagle Scout. I went to the Wharton School. I became a lawyer. I'm a, you know, a prudent, a pretty, you know, sensible business person and relatively successful. I'm not a nut, but you know, I just turned over one too many rocks, and I'm incensed that we allow this exploitation to continue. And it wasn't like that when I was a kid. I'm a relatively older guy. I can remember when, you know, if people couldn't afford to go to the doctor, they might bring a chicken or a bottle of pickles that the mother made and give it to the doctor. But we've become overly commercialized. The doctors are now cogs in this commercialized machine called healthcare, and we've lost our way. We've lost our way.
Well, here's the thing that I think that's interesting for you to say, you know, I'm not a wacko, or make some sort of reference that you're completely, you know, out in left field. The reality is that you're presenting very factual information that's very logical, that makes tremendous sense. And it's the kind of information that's not getting out to the general public. So how do we educate the general public to this phenomenal information that you have uncovered, or just maybe not necessarily uncovered, just brought to light?
Well, you know, what we are doing is we have this campaign, which we started 4 or 5 weeks ago. We have 140 now. We have 140 members, business members to the campaign. It's being run by the American Sustainable Business Council, which is supposed to stand up against the monster U.S. Chamber of Commerce in Washington. A David against Goliath, frankly, because the U.S. Chamber of Commerce is the largest lobbyist group in Washington, and is representing many of the interests that the special interests in their relations with Congress. So, yeah. So
how do people get involved?
How do they get involved? Okay, so we have a website called it's called fixithealthcare.com, and it has our movies. They can see our movies through the website. They can look at all of our research materials. They can review our frequently asked questions and answers to those questions, and they can go on the ASBC's website as well. There's another site that's called BLTH, not such a great acronym, but it's Business Leaders Transforming Healthcare.org, BLTH.org, and there we're starting to populate that site. There's social media. I'm traveling all over the country. Frankly, if they're in if they're in Oregon, Oregon has a single payer legislation that's 2 years in the works in their legislature, and it's moving along very nicely. They have thousands of activists. They have a business community that is beginning to rise up. I'll be there for 4 or 5 days in June, presenting our second movie throughout Oregon. California just put legislation in, and they have a very good prospect that it will be well received. They have a progressive legislature, a governor that is likely to win next year's election, and so there is a good shot that California and Oregon could become the first single-payer states. That's how it happened in Canada. One province of Canada, Saskatchewan, initiated this program was so compelling, so good, that it spread throughout the rest of the country.
So am I hearing you correctly in saying that, okay, so people can go to these different websites and get informed and learn more about the problem and the challenges, but it sounds like, I mean, sometimes we have to face reality. To go to the national level and take on the $1 billion spent by lobbyists to defend their big money-making machines called insurance companies, are you suggesting that people start advocating at the local level by creating legislation at the state level, and through the domino effect, we might see it impact the national level?
Well, that's one avenue. I think I would prefer that we certainly do a Medicare. We just expand Medicare to everyone. Medicare administrative costs are 2% and maybe 3-4% if you consider their outside contracting, compared to 20% in the insurance industry. I mean, it's pretty simple. We should have Medicare's more efficient, and Medicare's easier for the providing community to use. So people go to these websites, they get involved with your different organizations. People start to go, oh, okay, wow, there is a problem, and there's a clear solution. Well, what are the specific steps that people should take? Okay, let me be more specific.
Thank you.
There is a bill in Congress. It's the Conyers bill. It's HR 676. That has 110 now Democratic co-sponsors. Okay, and we're up dramatically from where it was a year ago. So you can get in touch with your congressman and voice your views and go to Washington and see him. And I think that is very effective.
Now you say, I think that's great advice. Thank you so much. So you're talking about this co-sponsored by primarily Democrats. What's the story with Republicans?
Well, the story with Republicans is that their solution to health care is to throw more people off the rolls. They recognize that health care is a huge expense on the federal budget, and so they're willing to save $500, $600, $700 billion by over time reducing Medicaid and the subsidies that are available under the Affordable Care Act to middle-class people so that they can be insured. They will reduce those to very little, and they will pick up $500, $600, $700 billion. Now, what are they going to do with that money? They're going to give it to guys like me who really don't need it. I don't need any more money. I'm a successful business guy, and Donald Trump doesn't need any more money. And Warren Buffett said the impact of the Republican law, if it in the House, it's passed the House, if it went into effect, it would reduce his taxes by 17%. And he said, I don't need it, Well,
I'm a little baffled by this, because I think the two numbers that you shared are almost the same. You're saying a single payer healthcare program could save about $500 billion.
Yeah.
And then you're saying over here that the Republicans want to save $500 billion by excluding people from healthcare.
Well,
why are not Republicans recognizing that they can save the money by going to a single payer healthcare system?
Well, follow the money. These congressmen have to run every 2 years, and they got to spend.
The Democrats.
They got to raise 200. They got to raise 200 million. They got to raise $2 million, let's say. And where are they going to get the money? They're not going to get it in their home districts. They don't. They get maybe 20% of what they raise in the home districts. They got to go to these little cocktail parties that are organized by lobbyists, right?
Yeah, but Democrats have to run too.
I know, and they get the money too. They do.
Yeah.
They get, so there is as we say in our movies, the healthcare lobbyists have a red team and they have a blue team. You know, they got a Republican team and they got a Democratic team. And, you know, there are now 1,300 pharmaceutical lobbyists alone, more than 2 lobbyists in Washington for every member of Congress. So this is the big problem.
Yeah.
You know, do we have a democracy?
I think
Let me ask you, do we have a democracy?
Yeah.
Yeah.
I think the people that need to be recognized are the Republicans that voted against this last health bill. I mean, those are people that have voted on their values and not by party line. And it just doesn't make sense to me that this has turned into a bipartisan discussion. It doesn't need to be. We can certainly show to Republicans that there's a conservative cost-saving approach to healthcare by doing a single payer. And for some reason, they're stuck in the old way of doing things and are not willing or able or whatever the case may be to look at a different way of doing things. And I think that sometimes, you know, we as people have a hard time with change. We have, I mean, for you to logically and present a very logical presentation about the values of a single payer healthcare system and actually consider that some of your ideas are wacko, you know, the bottom line is it's extremely logical.
Yes, it is. It is logical. Guess what? You know, what do I do as a business person? You know, I don't reinvent the wheel. You know, I adopt other people's accounting systems. I have engineers who use popular protocols in their analysis. So what we all did, is we look at what is effectively working in the rest of the world. What is we call it in the business world, best practice. You always look for the best practices. Well, the best practice, if you look at efficiency, if you look at health outcomes, if you look at cost, it's these single payer systems. And every other country in the industrialized world, in one form or another, has adopted it. And, you know, are we so in love with ourselves, with the concept of American exceptionalism, that we can't learn from other people? You know,
I think you kind of hit the nail with the hammer on that one. I think that there's essentially a sense of arrogance that Americans have and our political system has, that I think it's time for us to take a serious look at what we can learn from other people.
Even the simple thing of how we purchase drugs. We're the largest market for pharmaceuticals in the world. Why do we pay twice as much? Well, because we don't negotiate. And we developed a law, Medicare Part D, in the early 2000s, and under President Bush, and we put in a provision in that law that prevents the head of the Medicare system from establishing a national formulary for the system. This is a list of drugs that he will approve for use, and negotiating price. So we don't negotiate price. We have to accept the industry level price. So we don't have a reference price for pharmaceuticals in the United States. And as a result, we pay twice as much. Crazy. And that would be a simple fix, right?
So Richard, will you come back and we'll have another discussion about the pharmaceutical industry?
I'd be very happy to do that. It was really a pleasure to talk to you. You're a great interviewer, and I wish you all the best with your
all right. Well,
program.
Thank you. And I want you to know I'm looking forward to Chapter 2, to having a conversation about that. And I want you to know that I fully support whatever you're doing and all the efforts of everybody out there looking to move towards a single payer system. I'm encouraging the employees out there in America to contact and reach out to your employers and let them know that you support a single payer system, to get your employers to become active, to join these different business organizations with a united front, with a common voice that shares our concerns about healthcare reaching out to our government in Washington, D.C., and advocating for House Bill
676.
House Bill 676. It's critical that everyone listening, everyone out there that has now become educated to the real problems and the solutions that are so simple, to reach out to your congressman and tell them you really support Bill 676. This is Mark Hughes with Karma Talks, thanking you so much for joining us, and we look forward to another incredible conversation that we've had with Mr. Master in the near future. Take care.
Thank you.
As we continue to explore conscious solutions to our world's most pressing problems, be a part of the conversation and subscribe to our Karma Talks channel. Thank you.